You are definitely going to feel dizzy, nauseous, and possibly pass out during hair transplant. But I don't want you to be scared, and I'm going to teach you today on what to do to prevent those feelings you're having. If you're coming across this video for the first time, my name is Dr. Chefu. I'm a hair transplant surgeon and hair loss coach. I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. You know, the reason why most people don't post videos and pictures of the actual hair transplant is because some people, once they watch those videos, they actually feel dizzy and nauseous and they can't stomach it. That's really why you don't see actual videos of hair transplant. But now, that shouldn't prevent you from having a hair transplant if definitely that's what's going to help restore your hair. I remember this particular incident that happened during the process of a hair transplant. One of my clients felt dizzy, nauseous, and he almost passed out. And we had to stop the procedure for a couple of hours, and we had to make sure he was okay before we started the procedure. If this is you, you're about to go for a hair transplant, or you don't even know you're a candidate for a hair transplant, make that free virtual appointment at Havila Hair Restoration, and someone from my team will get in touch with you and talk to you. So today I'm going to be teaching you 5 possible reasons why you feel nauseous or dizzy or feel faint if you're going for a hair transplant. So if this is you, I want you to watch this video to the end because possibly the last one is going to shock you. So number 1, dehydration. Let me give you one tip. Avoid all caffeinated drinks. Also avoid coffee, avoid all herbal drinks, any tea, avoid all that. You want to strictly drink water, and eat something before your hair transplant. Now, this is a discussion you need to discuss with your hair transplant surgeon on how the procedure is going to go. If you need to eat something, you need to make sure you discuss that because that can actually make you nauseous if you're dehydrated and make you pass out. So you need to avoid that. Number 2 is your medication. You see, medication. Now, that is why it's very important you have a formal consultation, scalp evaluation before you actually go for your hair transplant because you need to disclose all your medical illnesses. Now, if you're hypertensive and you take medication for hypertension, or you're diabetic and you take medication for your diabetes. Now, medication for that diabetes can drop your blood sugar, especially if you don't eat before your hair transplant. Now, if you're hypertensive and you take your medication, guess what? That can also drop your blood pressure. Typically, do not recommend you avoiding or skipping your medication before your hair transplant because we still need to control the other medical problems. So you have to have that discussion with your hair transplant surgeon if you should take your medication, on what to do, if you need to skip the medication, and even if you're going to take it, are you going to eat something? Remember, we talked about dehydration. So if you're on blood pressure medication and you take it, that can drop your blood pressure and you can become nauseous, become faint, and possibly you can pass out. Number 3 is anxiety. You did not expect anxiety can make you nauseous and pass out? Yes, so anxiety can cause overstimulation of your vagus nerve. And what happens if there's an overstimulation? Your blood pressure can drop, you can become nauseous, dizzy, and possibly pass out. So what do I suggest you do? If you suffer from anxiety or if you deal with anxiety, you take medication for anxiety, let your hair transplant surgeon know. Or most times when we do hair transplant, I recommend you ask for something for anxiety before the procedure starts. I know most clinics will give you something for anxiety because we don't want overstimulation and that making you dizzy, nauseous, and possibly faint. We don't want that. Number 4 is pain. Yes, pain can make you nauseous and cause overstimulation just like anxiety. So most hair transplant procedures now, we actually give you good local numbing medication that's going to avoid overstimulation due to pain. So if this is you, you have a low tolerance for pain, make sure you discuss that with your hair transplant surgeon on what pain medication they're going to be using and what to do if you're in pain. So discuss all that. Go through all the steps with your hair transplant surgeon and we go from there. Number 5, the smell of blood or the sight of blood. Yes, most people can become anxious and get triggered and get overstimulated, become nauseous, and what? Feel dizzy and possibly pass out. So if this is you, you get overstimulated by pain, anxiety, stressful situation, because hair transplant surgery can also be stressful. You need to go over this with your hair transplant surgeon and talk to him, because we don't want you passing out during the process of hair transplant procedure. So, but now if you're dealing with hair loss and you've been thinking about hair transplant and you are worried about all these things I talked about, I think it's time for you to make that appointment. We offer free virtual appointment at Havila Hair Restoration. Someone from my team will get in touch with you and talk to you and find out what you want, and we'll formulate a good treatment plan for you. Now, if you've loved this video, that you're watching, I promise you're going to love every of my video on YouTube. I teach you tips and tricks concerning hair transplant. And I want you to head over to YouTube. YouTube name is Dr. Chefu. Until next time, bye-bye.